السلام عليكم ورحمة الله وبركاته. معاكم مسمار وهشام، وإن شاء الله هنناقش مع بعض النهاردة موضوع Ethics of Health Promotion and Disease Prevention. في الأول في outlines هنتكلم عليها، هي Introduction, the wages of sin, taxes, consumption and public health, restriction, prohibition and mandatory behavior, balancing civil liberties and public health, personal responsibility, economic and other incentives for behavior change, ethical dilemma in promoting behavior change, genetic testing and individual risk analysis, cases in health promotion and disease prevention. We conclude. في الانترودكشن بيقول إن ال health care associated infection أو ال hospital acquired infection are one of the most common adverse events in care delivery and a major public health problem with an impact on morbidity, mortality and quality of life. At any one time, up to 7% of people in developed and 10% in developing countries will acquire at least one hospital-acquired infection. These infections also represent a significant economic burden at a societal level. However, a large percentage of hospital-acquired infections are preventable through effective infection prevention and control measures. بيقول ان الهوسبيتال اكوارد انفكشن دي اللي هي عدوى المستشفيات اللي اغلب البيشنت بياخدها نتيجة طبعا اللي هي اللونج بيريود ستاي في المستشفى، بيقعد فترة طويلة. ممكن اكون انا بقدم له الكير بطريقة غلط، او ان انا مش محافظة على وسائل التعقيم والنظافة كويس، فبالتالي انا بنقل للبيشنت ده ميكروب ممكن يعمل لي مورتاليتي وموربيديتي. ممكن الميكروب ده يخلي البيشنت يضاي، ممكن البيشنت يموت مني بسبب ان انا ما حافظتش على الانفكشن بريفنشن البروكوشن المفروض امشي عليها علشان خاطر ان انا امنع ان يحصل له الهوسبيتال اكوارد انفكشن دي. Preventing harm to the patients, health worker and visitor due to infection in healthcare facilities is fundamental to achieve quality care, patient safety, health security, and the reduction of healthcare associated infection and antimicrobial resistance. يعني بيقول ببساطة ان انا عشان امنع كل ده واتفادى كل ده لازم امشي على الستاندرد بروكوشن بتاعة الانفكشن كنترول، اللي هي طبعا المستشفى بتكون محدداها او منظمات العالية زي الGCI او الايزو، اللي هي بتبقى حاطه ستاندرز معينه وبريكوشن معينه لازم نمشي عليها واحنا بنقدم الكير للبيشنت عشان نتفادى الكلام ده كله. Similarly, preventing and reducing the transmission of infectious disease that those global threats such as pandemic influenza, Ebola virus disease, and other viral hemorrhagic fever is paramount. بيقول إن new guidelines on the core component of infection prevention and control programs form a key part of WHO strategies to prevent current and future threats, strengthen health services resilience, and help combat antimicrobial resistance. They are intended also to support countries in the development of their own national protocols for infection prevention and control and AMR action plans, and to support the healthcare facilities as they develop or strengthen their own approaches to infection prevention and control. Successful implementation of a recommendation and the good practice statement is dependent on the robust implementation strategy and a defined and appropriate process of adaptation and integration into relevant regional, national, and facility level strategies. Implementation effectiveness will be influenced by existing health system. يعني بيقول ان التطبيق لما اجي اطبق الاستراتيجيز دي في المستشفى بيتأثر بايه؟ بالسيستم اللي اوريدي الهيلث سيستم اللي موجود عندي في المستشفى in each country including available resources and existing capacity and policies. زي ما احنا قلنا ان كل مستشفى بتحط بوليسي معينة ليها علشان خاطر تطبق البروكوشن ده او الستاندردز دي. The support of key stakeholders, partner agencies and organizations is also critical. اول حاجة هنتكلم عليها the wages of sin اللي هي taxes والconsumption والpublic health. taxes دي اللي هي الضرايب اللي المفروض الحكومة بتفرضها على البرودكت. From the point of view From the point of view of economics, such taxes would correct for market imperfections. They would pass on to consumers the true cost of their behaviors by having the price of a dangerous product reflect the cost imposed on society by the consumption of such a product. From an ethical point of view, efforts were made to justify such taxes as central to a more equitable distribution of the burdens associated with certain behaviors. consumption اللي هو الاستهلاك بقى ده raising the price of cigarettes to customers to a level that fully reflects social costs generated by their consumption. Under these circumstances, an efficient price means that cigarettes are purchased only by those for whom the net benefit of cigarettes, even when that price fully reflects the social cost of consumption. If balance between social cost and customer price is the objective of the policy, the government doesn't wish to impose taxes unless the internal social cost exists. And the government would wish to cease taxing at the point where price reflects social cost. How would price increases affect the consumption of an additive product? What was the elasticity of demand for cigarettes among those who might be poised to begin smoking, young smoker, those who had smoked for years? سؤال تاني, did smokers impose collective burdens on non-smokers because of the medical cost they incurred, and did equity justify or require the internalization of such negative externalities? تالت حاجة عندنا بقى وهي ال public health. Increased prices, unlike direct prohibitions, ultimately leave to the customer the choice whether or not to purchase the product. ده بسيب حرية الاختيار للبيشنت, هل هو بقى عايز يشتريه ويدفع التاكسز ويضر نفسه ولا هيحافظ على الهيلث بتاعته. Because they permit such choices while imposing burdens expressed through the market, some have viewed them as a less troubling paternalism, but at the end of the day, for those who must pay, is such paternalism in fact less troubling? To the extent that current policy doesn't cover all products linked morbidity and mortality, can we conclude that the decisions are reflective of the pattern of an individual's discrimination, even moralism, masquerading as public health? في عندنا 3 حاجات تانيين نتكلم عليهم اللي هما restriction, prohibition and mandatory behavior. restriction اللي هو المنع. It is only when governments seek to restrict the availability of a product, ان هي تمنع البرودكت ده خالص في السوق when integrated into the social fabric, or when it plans to mandate behavior that is not already required, that the ensuing controversy brings to the force the ethical issue that undergird even the most widely accepted practices. prohibition بقى عندنا on the sale or prescription of many intoxicating substances are challenged only by libertarians opposed in principle to any but the most limited restrictions on individual liberty, pure food and drug laws, as well as legislation governing the use of potentially carcinogenic food additives, are not only rarely opposed but often demanded by those committed to public health despite the clear impingement on liberty and autonomy of potential consumers. تالت حاجة اللي هو mandatory behavior. The debate surrounding mandatory motorcycle helmet laws, which occurred more than 3 decades ago, provides a unique window on the extent to which explicitly paternalistic measures can encounter opposition and as a consequence require justification compatible with the individualistic trends in American culture. From the moment of injury, picks the person up of the highway, delivers him to municipal hospital and municipal doctor provides him with unemployment compensation if after recovery he can't replace his lost job and the injury causes permanent disability, may assume the responsibility for his and his family's continued assistance. We don't understand the state of mind that permits the plaintiff to think that only the himself is concerned. بعد كده في عنوان تاني اللي هو balancing civil liberties and public health. The most obvious and ancient of this ethical issue involves finding right balance between a need to protect civil liberties and the need to protect the health of the public. When does the protection of public health justify restrictions on individual liberty? Until recently, standard response to public health threats, particularly plague and communicable disease, was to put the good of the community ahead of the liberties of individuals. Personal responsibility. If there can be occasions when civil liberties may legitimately be restricted on the name of public health, what are we to make the way of people manage their own health? Personal responsibility بيقولك ان دي حرية اختيار للشخص ده هو، هل هو عايز فعلا يحافظ على الهيلث بتاعته ولا مش عاوز. Are individuals to be held responsible for their health related behavior؟ هل هم هيتحكموا في البيهيفيرز بتاعتهم دي ويحافظوا على الهيلث ولا لا؟ It is not an easy question to answer. It touches in a complex way on two important Western convictions, not easily reconcilable. On the one hand, we in the West tend to believe that people should be free to live their own lives and to make their own choices about crucial aspects of their results. Economic and other incentives for behavior change. If there is a change of steps that might be taken to change a harmful social context, there is no less a range of possibilities in trying to influence individual behavior. These options run along a continuum from coercion at one end of the spectrum, thought manipulation, seduction, and persuasive education, to a neutral, just the fact approach at the other end. Fear can be employed incentives and disincentives can be devised, and self-interest or altruism can be invoked. الethical dilemma in promoting the behavior changes دي احنا عملناها قبل كده في work يعني. If there are some important uncertainties and ambiguities about the economic implications of health promotion and disease prevention, that is no less the case with its ethical implication, although multiple ethical dilemma could be examined in this regard. We will limit ourselves to an overview of four of the most silent and time اللي هما الأربعة dilemma: finding the right balance between protecting civil liberties and protecting the health, holding individuals responsible for their health related behavior, the use of economic incentives, the rise of genetic testing. رابع نوع اللي احنا هنتكلم عليه اللي هو genetic testing and individual risk analysis. بيقول ان health promotion and disease prevention as public health strategies have always depended heavily upon the calculation of probabilities. A person who makes heavily over a long period of time has an increased probability of lung cancer or heart disease, just as an obese person has an increased probability. اللي هو ده نظرية الاحتمالية، بيعتمد على ال calculation of probability. يبقى ال health promotion و disease prevention زي ال public health strategy ده بيعتمد على ايه؟ على نظرية الاحتمالية، النسبة قد ايه، نسبة الاحتمال قد ايه ان هو يحصل. بيقولك a person who smokes heavily over a long period of time has an increased probability، عنده احتمالية كبيرة ان هو يجيله lung cancer او heart disease. والobese person عنده برضو increased probability ان هو يجيله diabetes. But there has been a long-standing problem that a method of calculating risk it tells us too little about the risk to a given individual. بيقول ان في many heavy smoker ما بيجيلهمش lung cancer ولا heart disease and many obese people ما بيجيلهمش diabetes. مش حاجة بالضرورة ان عشان بيعمل كذا يجيله كذا، هو نظرية احتمال بيبقى ليه نسبة. cases in health promotion and disease prevention. أول حاجة عندنا health communication campaign and censorship of advertising. The using the case of tobacco highlights the tension between the robust conceptions of freedom of expression and the claims that the protection of the public health requires bans or restrictions on advertising that many stimulate the consumption of tobacco products. تاني حاجة عندنا اللي هو taxes on consumption and public health. بيقول إن increasing taxes on cigarettes to limit consumption highlights the tension between the claims that individuals have the right to purchase products that give them pleasure even if they produce illness, and the public health claims that there is an obligation to inhibit behaviors that can predictably be the cause of morbidity and mortality. In this instance, the tax-induced increase in price doesn't represent a prohibition, but the creation of an economic burden that leaves individuals formally free to choose. Mandatory motorcycle helmet laws. This case places into bold relief the assertion that the protection of the public health as represented in decreases in morbidity and mortality may justify the imposition of outright prohibitions designed to protect individuals from their foolish choices that incidentally may also produce burdens on society. في الآخر بقى في conclusion بنقول because health promotion and disease prevention seem so utterly and immediately persuasive, it has been all too easy to see the problem standing in their way as technical matters only. How to devise and implement effective programs and policies. But it should be clear by now that efforts to improve health and to change personal habits and to work on unhealthy environment and social determinants of injury and disease touch on many of the fundamental tensions and the dilemmas addressed. The fact that so many efforts to improve health behavior have failed, that progress in health promotion is so difficult, and that there may now be something of a public backlash against what may perceive to be an officious health signals the need to bring these dimensions to the foreground. If the idea of ways of life, ways of health is true, then nothing less than a more comprehensive analysis of the interplay of societal value and health value. يا رب تكونوا استفدتوا حاجة من المحاضرة، والسلام عليكم ورحمة الله.